This conference will now be recorded.
Okay, so I think because we got a lot of ground to cover today, I think we give Johan about 60 seconds and then we just dive right in. Now, Ragnar, I get hope from Johan whenever I speak to him that life can return to normal quicker than, or more quickly than, the folks in North America are projecting right now. He says kids are in sports, school is on, sleepovers are happening. So we can return to some semblance of normality pretty quickly. Oh, I think you're on mute.
No, I mean, as you know, Norway is a small country, and we take orders. And having said that, things are returning to normal. Um, it wasn't that actually during the lockdown. It wasn't that bad in the first place because you were allowed to be outside. So you've been to Oslo, so people like to be outside, so you could exercise and be in the forest and basically do what we like to do. But now schools have reopened, kindergartens have reopened, and we are returning to normalcy. Even restaurants and bars have started to reopen, and people are returning slowly to their offices. But most people are still working from home. So we're not there yet, but quite a bit has happened over the last 2 or 3 weeks.
Fantastic. So there is hope. I know, Julie, when I usually get on the phone with you in Florida, you feel the farthest away from coming back to something that resembles normality.
I think that's true, though Florida's reopened because of their tourism industry, which I don't know if that's the best decision right now, but we'll see.
Okay, I see Adrian Keller has also joined. Adrian,
Hi,
hello.
Hi, everybody. Can you hear me?
Adrian, we can hear you. In fact, I spent the last night of my pre-corona life with you in Liverpool.
Yeah.
And
You know what
the
happened
game
now?
we happen to be at has become quite a divisive topic across the UK because, in fact, 3,000 fans from Madrid flew into Liverpool and they're actually blamed with the outbreak in the city.
Oh, great.
Okay, so I think we're going to dive in without Johan, unless he just texted me, which he didn't. So how about we just get started? So I would love to, first of all, welcome everybody. We were most certainly planning to do this in person a month and a half ago, before COVID happened. But we're really excited to have everybody together today on the phone. And I think, we're learning a lot at Right to Play about what we can do virtually. And I think, in all likelihood, this may be one of the new, and it's hardly an innovation, but ways that we can start to connect as a group, because it's been tough, obviously, to get the Global Leadership Council all together in the same place. So I think, depending on how today goes, maybe we start to do this a little more often to keep everybody updated and connected. I hope that everybody is healthy and safe. And for anyone who has loved ones on the front lines or providing essential services, definitely thank you for the role that you're playing in this. I'd like to just quickly let everybody know who is going to be participating in the call and what the roles will be. So Susan McIsaac, who many of you have met, is our Chief Philanthropy Officer. I don't think we get to call you new anymore, Susan, and Susan's going to be facilitating the conversation. Then we have Rebecca Winthrop, who I think, Susan, you'll introduce a little bit later, who's an international board member and literally a global thought leader on issues of education, especially in the global south. We have Patrick Nyeko, the country director from Tanzania, who will be able to give us a view from the ground, and then I'll be talking a little bit about Right to Play strategies. What we'd like to do is to keep the session as interactive as possible, so feel free to interrupt, chime in, jump into the chat window. We really want to make this as useful as possible for everybody in the call and really as engaging as possible. So let's get right into it. Obviously, COVID has had an impact globally, and Right to Play is no exception. I am happy to report that while we've had a number of staff cases in a number of countries, everybody's fully recovered. So everybody's healthy and recovered, and we're taking the measures we need to to keep our staff safe. Over the last week, 8 weeks actually, so this is we're getting some feedback. And perfect. Over the last 8 weeks, in fact, since Adrian and I were at the match together in Liverpool, Right to Play has been rapidly transitioning to distance and remote programming, and we'll learn a lot more about that in the next little while. And working closely with our international board and many of our national board chairs who are on this call, who've spent a lot of more time on Right to Play in the last 8 weeks than they're probably used to. Again, I'll just remind everyone to go on mute if possible. I'm getting a ton of feedback. But working with the international board, we've made
Kevin, can you have everybody on mute who's not talking?
That sounds like Larry. Hi, Larry.
Hi, Kevin.
Okay.
Kevin, can you have everybody go on mute that isn't talking?
Yeah, that's what I'm going to try here. Oh, I'm just having a quick look. So folks on the phone as well, going on mute would be great. Perfect. I think we're back in
Kevin.
Yeah.
So I'm probably causing the problem because I'm calling in as well as on my computer. I'm going to be gone for a couple of my cursor is now frozen up on or go to meeting, so I can't do anything on my computer. So I'm going to have to reboot. I'll be back, I hope.
Okay, thanks, John. Sorry about that. Which just proves you were right. GoToMeeting is not the go-forward solution for us.
No.
Okay. We'll see you again in a few minutes, John. Thanks. And welcome, Larry, to the call as well.
Thank you, Kevin. Nice to be on it.
So we're working very closely with our international board. We've made the necessary adjustments to ensure that we remain strong, both financially and operationally, throughout this crisis and afterwards. Our highest priority, and you'll hear about this over the course of the next 60 minutes, is to ensure that the children in our programs remain both safe and healthy, and that equally importantly, they continue learning despite school closures around the world. We only have an hour today, and now we have even less than an hour. So we're going to cover probably way too much information in way too little time. But I'm happy to jump on the phone with anybody or a Zoom call in the coming weeks to really take a deep dive into our interventions and what we're doing. So please just send me an email afterwards if you'd like to get any more information or spend a little bit of time learning about how we're responding. Before I turn it over to Susan McIsaac, though, one quick announcement. I think a positive announcement. We were all hoping to be together, like I said, a couple months ago in April. But at the GLC Summit, at the Global Leadership Council Summit, we have rescheduled, and a calendar invite is coming for 2021. So where's Wheatlishbach? I'm not sure if he was able to make the call today. Has again graciously agreed to host in Zurich and Zug. And there will probably be an extension with Sami Sawiris in Andermatt. And the dates, so just pencil these in, and let's all assume that life has gone back to normal and we're traveling April 14th to 17th in Switzerland. And we will have, again, an amazing slate of world-renowned speakers. And I believe the exclusive ski experience with the Swiss ski legend Bernard Russi is also going to be part of the weekend. So circle that on your calendars. Keep an eye out for the invite coming. So with that, Susan McIsaac, I'm going to turn it over to you to get us started into the session proper.
Thanks, Kevin, and a very warm welcome to all of you. Thank you for joining our call. We're going to try to make this as interactive as possible, so feel free to jump in at any point. You can also put questions in the chat box to the right if you open that up. And we really look forward to you engaging with us. Points of clarification, questions that might take us in another direction, it's all welcome. But I do want to, before we get into it, provide a bit of a formal introduction to Rebecca Winthrop. She has recently joined the Board of Right to Play. She's a senior fellow and co-director of the Center for Universal education at the Brookings Institution. Her research focuses on education globally, with special attention to the skills young people need to thrive in work and in life. And prior to joining Brookings, Rebecca spent 15 years working in the field of education for displaced and migrant communities. As the head of education for International Rescue Committee, she was responsible for the organization's education work in over 20 conflict-affected countries. Rebecca works to promote quality education, including exploring how education innovations can leapfrog progress, particularly for the most marginalized children and youth. She advises governments, international institutions, foundations, and corporations on education issues. She lectures at Georgetown University and serves as a board member for a number of global education organizations, most notably the International Board of Right to Play, for which we are, of course, most grateful. Rebecca, I'm going to turn it over to you now.
Great, thanks. Hi, everybody. Really nice to meet you. Kevin asked me to just give a little overview to kick things off. And I thought I would do three things. One, just tell you about highlights, snapshots of the picture of global education pre-COVID, a few highlights during COVID, what we know so far. And then the third thing is, what are a couple of things that we all who care about children's learning and education and development need to look out for in the COVID recovery, kind of post-COVID phase. So let's go to the next slide. To kick off on this first one, this is a topic I've done quite a bit of research on because we work with a number of countries at Brookings and look globally. And the picture before COVID on global education around inequality is pretty dismal. You can go to the next slide. So there was a very large UN commission that we helped found that did a big scan of the latest evidence, not only of kids in school, because for quite some time we've been counting kids in school and kids graduating around the world, particularly the developing world, but really also what are they learning? What are the skills they're developing? And that has actually been a big shift for the global education field. And the answer is not much. So this is the projections by this large UN commission that by 2030, which is this year of the Sustainable Development Goals being, the targets that theoretically we're supposed to meet, half of all the young people in the world are not going to have the secondary level skills. So this is in America, high school, secondary education. So they're not going to have the basic skills. And when we looked at basic, when they looked at basic, it was very basic. Basic literacy, basic numeracy at a secondary high school level, basic critical thinking and basic problem solving skills. So can you go to the next slide? And one of the things that we found is that this is a truly global problem, but it is the developing world that is by far the hardest hit. So if you go on the right-hand side, you'll see it's high-income countries like where I live, the United States, Canada, where Right to Play is headquartered, etc. About a third of their kids, most of whom are in school, but are not going to meet the basic secondary level skills, very minimum. In middle-income countries, it's half of the kids you see in red aren't going to meet it, but look at the low-income countries, which is where most of Right to Play works, are not going to meet basic secondary level skills, 9 out of 10 kids. Based on our current approach to education, our current projections. And we know that it's not just sort of literacy and numeracy skills. We know all kids are going to need 21st century skills. They're going to need digital literacy if they want to thrive and compete and not be totally left behind. They're going to need collaboration skills, teamwork, etc. And those are not looking great either. A recent study came out that showed that there's a multi-country study, diverse, different geographies around the globe. 9 out of 10 kids could not distinguish in a very short paragraph fact from fiction. And that includes kids in, frankly, in high income countries equally as kids in low income countries. So we're dealing with a pretty big learning crisis. Next slide, please. Yeah, okay, yeah, projected learning, whoops, yeah. So, and one of the things that we looked at is we said, okay, well, if we're to continue everything that we're doing today as per normal, how long is it going to take before the best of what today's education is delivered to all kids equally? And what we found it's going to take 100 years. So I'll put it in terms that are really meaningful for right to play. The average student in a developing country, so Tanzania, what have you, it's going to take 100 years to reach the worst student, the bottom 5% of students in a developed country. So there's large inequality on many facets, but largely between kind of rich and poor countries and between rich and poor kids within countries. So that's the state of play before COVID happened. And inequality and having a sharp focus on skills and capacities and learning was really the name of the game, and how to close the 100-year gap. So now, go to the next slide, please. What do we, what's happening to global education during COVID? We don't have a huge amount of data because it's happening in real time. We've been doing a lot at Brookings and working with various colleagues around the world to just track what we can. And something happened in March that has never happened in the world ever of education. You can go to the next slide, where on the beginning of March 1, this year, there were 6 countries that closed their doors to schooling and tried to find alternative arrangements while they sent kids home. And then at the end of the month, just 4 weeks later, 190 countries had closed their doors to schooling, and we're trying to figure this out. This is so unprecedented. We've never had a context like this, where all of a sudden the world's schools just close, and they try to figure out what else to do. So we know from past emergencies that aren't necessarily global pandemics like this. We do know, how in past emergencies we've tried to keep educational continuity going, and you can go to the next slide. And yeah, go ahead, next slide. Lots of animation here. So what countries are trying to do is distance learning in some way, shape, or form. And this is probably a little too tiny now that I see it on my little screen. I don't know what size your screens are, but the basic upshot of this, we're tracking what countries are doing. And in low-income countries, which is on the left, the very short bar, in the blue, about 25% of countries are providing some form of online learning, remote online learning, broadcast and online learning. And in the United States, in high income countries, it's about 90%. So this is just one snapshot of what's going to be what COVID is going to do is widen the inequality gap. I'm sure you are all talking about that already across many dimensions of society. It is very, very true for education, because all of a sudden schools, even though they weren't perfect, but without them, they have basically unmasked and revealed bare the deep inequalities that exist within our countries, because you're faced with, just the home resources and whatever that particular jurisdiction can manage to provide. So that's a really big worry, is around educational continuity. Can you go to the next slide? In terms of moving forward, I don't have a crystal ball. I can tell you what we're starting to see in terms of trends, what people are talking about in this space when we talk to governments, ministers, donors, funders, other research institutions, practitioners, and I can also, it's also informed by what we know about what happens to education in emergency and crisis settings. So there's kind of 4 big things to look out for. One is learning loss. We just know that and you'll know in your own countries, if a kid goes home and is living with family that has no books, their reading skills are gonna go down. In the US, there's something called summer slide, where kids sort of lose some of the learning from the end of their grade over the summer, and they come back kind of a few months back, all kids. Now, if you're from a high income family and you have camps and enrichment and literate parents and you do all sorts of things, that happens less. So it's really for the poorest kids that this is worrisome for. Every emergency there is learning loss. I'll give you a small example. In Hurricane Katrina, which was this big hurricane in the Louisiana some years ago in the United States, the US didn't handle it particularly well in terms of their response. But those kids were out for a little bit before they got back into school systems. It was the United States with, infrastructure, and they were the kids who were hit by the hurricane compared to their, peers who kept going to school were 2.5 years behind. So there is going to be learning loss. So trying to make up for that is really important. The other thing to watch out for is there's always very, very serious risks for the most vulnerable young people in our population or in a society. There's very difficult decisions families have to make when their income shrinks. So I'm thinking about sub-Saharan Africa, huge number of people in the informal economy when things are shutting down. The number of people who are food insecure in the world has doubled. They're going to start, we always see kids being pulled out of learning and school and learning activities when people are faced with starvation and real survival. Child labor increases, child marriage increases, sexual abuse, domestic violence increases. So that those types of risks we're really worried about and we need to watch out for. The third big thing is the education sector overall, particularly in this crisis, might come out of COVID very weakened, because we're already seeing ministers of finance, governments, and big donors, the World Bank, the Gates Foundation, et cetera, saying we're going to prioritize funding for health, which they should. It's a health pandemic, for social protection like food security and things like that, and for economic revitalization. And we are really worried about education budgets being severely cut. And some of the work we're doing is trying to shape the narrative to say, nope, education is a part of your solution, and to COVID, and we can talk about that. So that's another piece to think about long term. What is our strategy in a more severely constricted budget environment? And then the last, which leads from that, the last thing to look out for is really, necessity is the mother of invention. There's opportunity amid crisis. I think that there always has been in past emergencies, and we really need to have our eye out to innovations and ways to educate kids that are different, more cost effective, rely on different resources within the community, different strategies, online, blended learning, etc., online, offline with power. There's lots of innovations out there. You can go to the next slide. Lots of innovations out there. We've done a huge scan and have a global database of education innovations that could really accelerate this pace of change and leapfrog over this 100-year gap. They're really often on the margins rather than the center of a system. And I think that's something we all need to lean into to help address the increasing inequality that's going to come from COVID. Thanks, Susan. I'll stop there.
Thanks, Rebecca. Really interesting. We need to hear more about your thinking on those leapfrog potential, and I think we will come back to that. But just before we do, I wonder, Kevin, Rebecca has laid a really interesting context for us and has provided great insight at a global level. Can you take that for us to a more regional perspective and looking specifically at where right to play is in Africa, Asia, and the Middle East, and talk a little bit about what's happening in our context?
Absolutely. So I think, as everybody on this call knows, and I think many folks on this call have actually visited our programs in different countries. We're in 15 countries, as you mentioned, across Africa, Middle East, and Asia. We're also in 85 Indigenous communities in Canada. And we're working specifically in 52 refugee camps, which are going to be, I think we've got somebody coming off mute again. 52 refugee camps around the world. While the response to COVID has been very different in every one of the countries where we work, there are some commonalities. In all the countries where we work, there is some form of a national lockdown. I think Patrick will talk to us a little bit about Tanzania. And as Rebecca said, children are out of school in every country where we work, except for one. Burundi seems to be the exception to most rules at this moment. So their schools are open. They happen to have a national election on May 20th, which probably has a lot to do with this. But I read an hour ago, they've just kicked the World Health Organization out of their country as well. So kids are in school, no lockdowns, but the World Health Organization has been asked to go home in Burundi. As you know, and I think as Rebecca referenced, Right to Play works with some of the most vulnerable children in the world in some of the most precarious contexts. And I think that there are three characteristics of these contexts that are particularly relevant and particularly troubling for the children that we serve in this crisis. I think the first is just insufficient access to quality health care. So for most of the children and families and communities we serve, treatment is not a realistic option. The New York Times reported 2 weeks ago that 10 African countries have no ventilators. To give a bit of scale to this, in Mali, a country where Right to Play has large child protection programs, large national scale education program, it's a country of 20 million people, and they have 3 ventilators. We'll get into kind of what we're doing, I think, a little bit later, but that's why prevention becomes so important, because treatment is not an option. Secondly, the places where we work have some of the highest population densities in the world. So the urban slums and the refugee camps where we work are the perfect conditions for this virus to spread. Some of you will have visited them with us. You'll often see 3 and 4 generation households living in a single room. I saw an interview with Bill Gates a week ago where he expected these communities to be the hardest hit 2 years from now, when the history books hopefully are looking back on this crisis. And I think the third complicating factor, and this underscores everything, Rebecca, you talked about this, are just economic realities that make isolation and quarantine practically impossible. The world's poorest do not have savings. They have to work every day to earn the money to buy food. And that's why you're seeing food insecurity being a byproduct of this crisis. And they have to go to the market every day, packed, jammed markets that are not particularly clean and certainly not sterilized, to buy their food on a daily basis. And I think, Susan, because of these 3 characteristics, the communities where we work are going to be some of the hardest hit in the world. And I think, Patrick, you and I were texting back and forth yesterday as Tanzania ended up in some of the front cover of Canadian newspaper, front cover of BBC News as well, that we're seeing exponential increases in a number of countries in Africa and real underreporting. So I think, Susan, specific to the context of countries where we work, those are 3 characteristics that are super important to keep in mind at this time.
Thanks, that's helpful, Kevin. Patrick, hello out there in Tanzania. I wonder if you can take us even further to a country level, and if you can talk a little bit about on the ground what you're seeing. I think many of us are quite insulated in our worlds, and it would be quite interesting to hear what's happening and how that's affecting the children.
Yeah, thank you, Susan. So in Tanzania, basically, we registered the first case of COVID-19 on March 16th. It was in Arusha, and government responded by closing schools and putting restrictions on public gathering. As of April 29th, there were 480 confirmed cases of COVID-19, and there were 16 deaths reported. But there's a lot of doubt about this figure, and that is coming out from the government. For example, the president claims that he took some samples from goats and quails and papaya, and he sent those samples to the national laboratories, and apparently those samples tested positive. And so his reaction was that he suspended all the testing, all the people that were carrying out the test at the national laboratory. and therefore he has instituted investigation going on. So from April 29th to date, we actually do not have any update. Even before the suspension, we were having only 40 testing taking place a day. So yesterday, the U.S. Embassy actually was sending out a warning to Americans in Tanzania. They're saying that the hospitals in Dar es Salaam are overwhelmed right now with COVID-19 cases, and that people should stay at home, and Americans who can find means to leave Tanzania should leave. So the situation in the hospital right now is really overwhelming, and at a point where I think if government doesn't act right now, we don't know the number of deaths that the country will register. In a span of like 11 days, we have had 3 members of parliament who died, also because of COVID-related illness. One of our colleague, country director for International Center for AIDS program, he was from Argentina. His name is Fernando's. He also passed away from COVID-related illness. So actually the biggest challenge we are having as a country in Tanzania is misinformation. You know, the president went on media. He was saying that this virus is in Swahili they say Shitani, which basically means Satan. It cannot live in the body of Jesus. We have to pray it out. And so places of worship are open, even if they're saying that there's a restriction on public gathering. Places of worship are open, the mosques are open, people are going into the mosque, you know, and to pray. And for us, you know, the biggest challenge we see, and we see that and this crisis has already started taking a tremendous toll on children. For example, in the month of April and March, our field team in Serengeti and Tarime reported that there is a surge in the number of young girls that are now undergoing female genital mutilation. And we know that when these girls undergo through this practice, you know, they will actually end up being married off. So the possibility of them going back to school is drastically hampered. So it is one of the most worrying factor that we're having to deal with, given the fact that before COVID, access to education, especially for the young girls in those rural areas that we are working in, was really very hard for them. So right now, this is what is going on. We do not have any update since April 29th to date. We are now depending on the foreign embassies to be able to get some information. The government is very strict. If you share any information on social media that is not coming from the government website, you are actually prosecuted. We have people that are now in jail because of sharing or talking about these COVID-related issues in the country. Yeah.
Goodness, Patrick, that's dire. Thank you to you and the team for continuing your work on the front lines. Kevin, I wonder, it's interesting to me. I suspect the story that Patrick is telling is not dissimilar to a number of our other countries. Can you provide us a bit of an overview of how we're responding, how our program teams are responding across Africa, Middle East, and Asia?
Sure. So we have a very clear 3-pronged strategy that we're implementing this year to respond to the COVID crisis, and it has 3 priorities. And the first priority, as I mentioned before, is keeping children safe and healthy. So protecting children this year is our #1 priority. And prevention is really the only viable strategy, as I mentioned earlier, due to insufficient healthcare, economic realities, population densities. But as we just heard from Patrick, and this is similar across many of the countries where we work, knowledge about what this disease is and how to prevent its transmission is very low. And I saw, Johan, you joined, and so welcome, Johan, as you know better than anybody, for 20 years, actually, all the way back to our founding. we've been working on disease prevention. So teaching children and their communities how to protect themselves from disease. Many of you will have visited our programs where you saw our programs around using mosquito nets to protect themselves from malaria, how to properly use condoms to prevent sexually transmitted diseases. Or we've actually been doing hand washing for 20 years to prevent communicable diseases, things like diarrhea, which is a major killer of children in Africa. So what we're doing in COVID is really using our past expertise to teach children and their families about effective hand washing and social distancing. And, I think it's fair to say that our interventions, and we'll hear a little bit more about Patrick about this, are literally saving lives through this crisis. The second focus is once we've made sure that children understand the disease, how it's prevented, and how to change their behavior to prevent its transmission, we have to keep children learning. So as Rebecca said, there's a massive inequality gap, and when children stop learning in many of the countries where we work, there's a good chance they won't go back to school. So we're working very hard to make sure that there are learning opportunities for children while they're out of school. It's almost all distance learning at this moment, although we do believe schools are going to be opening again in the coming months. We'll hear a bit more about this, I think, later, but we're using TV, radio, online learning. Rebecca, you said necessity is the mother of invention. There's all sorts of invention going on at Right to Play that I think is going to really inform our strategy going forward. In Mozambique, we were just selected by the Ministry of Education to partner on a daily educational TV show that's going to use Right to Play's methodology. It's going to be shown nationally, regularly, to help children learn from home using television. And then the third prong of our strategy is keeping children mentally and emotionally strong. Again, we've got 20 years of experience in war zones, after natural disasters, and in pandemics, and we know the psychological and emotional toll that takes on children. And so we are currently distributing, with the support of the Lego Foundation, 100 social and emotional support activities for parents to engage with in their children, to engage with their children. And we're doing that via radio, TV, WhatsApp, all means that we can find to get resources to parents and their children. So those are the three focuses through this year and potentially next year of our strategy.
Thanks, Kevin. Rebecca, I want to turn to you for a minute. Kevin referenced, looking at past crises for learnings. After your many years at Brookings and your 15 years prior to that, more closely in the field, you must have some crises that you've worked through, and we'd be interested in hearing what kinds of responses or interesting innovations you've observed over the years.
It's interesting. I mean, I think I've worked in lots of places, from Afghanistan to Sudan to Liberia and kind of everywhere in between, Kosovo, etc. So they're all very different, of course, because there's a political and contextual and cultural element, but there's a couple of sort of common threads and common principles that seem to play out everywhere. And one of them is what Kevin talked about, which is that we know from being in the field and seeing it live, so experiential knowledge, but also from now a lot of research, that education actually does save lives. And so the traditional sort of mental model, at least when I first started working in this education and emergencies field, which was quite nascent 25 years ago when I started, was people usually thought, no, do life-saving interventions first, do health, do water and sanitation, do shelter. And I'm seeing this mental model come out now where all these countries are saying we're going to prioritize health, social protection, and economic development and a sort of economic revitalization, all good, but they're missing the fact that education actually has a really important role to play as a tool in the toolbox to combat COVID, the way Kevin talked about it. So every single crisis, because education networks are one of the, keeping schools going and schooling going is one of the only ways, particularly in low-income countries, to reach almost all families or all kids. It's one of the best distribution networks in the country. So for vaccines, for health messages, for food distribution, come to school, you get a take-home ration to your family. It's one of the best ways actually to combat food insecurity. So we've seen that in multiple contexts. And you know, we did that a ton, for example, in Afghanistan, where you would get, if you send your girls to school, you would get, this is sort of, you know, right after the fall of the Taliban, you would get take-home rations. So families were incented to send both their girls and boys to school, for example. So I think we need to lean in heavily on that component right now, and make the strong argument why it's so important. And we also know, because I think Patrick brought up a lot of really good points, that it's hard to monitor children's welfare when there isn't a mechanism for regularly checking in on them. So, you know, education is also a way to protect children. And the sort of regular routines, I think Right to Play was one of the really fastest groups I saw to pivot and start quickly doing these life-saving messages and start doing the psychosocial support. And we also know that if there's a lot of evidence to show, if you continue education, and it doesn't have to be drill and kill, learn your maths, it's just education-like activities, it's a normalizing activity, the types of games that Right to Play distributed, it really helps children's mental health. We know that. So, you know, I think those are all really important things to keep doing.
Yeah, that's terrific. Patrick, I wonder if you could build on what Rebecca has described and give us a couple of examples, local examples in Tanzania, of how you're actually doing that on the ground.
Yeah, thank you, Suzanne. So for us as a country office, our main focus has been during this crisis to keep children safe, healthy, and continue to learn even while they're at home. And so one of the first things that we did as a country office was to close the information gap that we saw. At the beginning, at the onset of the crisis, government produced some information leaflets, and you know, the information leaflet produced by government did not look like something that was meant for the younger audience. And for us in communities where we work in rural areas, we know that in many of the households, the children might be the only member of the households that can read because they have been able to go to school. And so for them to be able to get information that is child-friendly and engaging, that means a lot that they can also share that information with their parents. And so when the ministry produced that leaflets, which was really, I would call it boring leaflet, we actually wrote to the National Task Force through the Ministry of Health, asking them to allow us to help them make these leaflets and every information that is coming to be child-friendly and engaging. So sure enough, they accepted our support. Right now, we have been allocated the responsibility on the National Task Force under the Race Communication and Community Engagement Subcommittee to make sure that we shape all the communications, whether it is leaflets, radio messaging, TV messaging, every communication that the task force produces, we need to make sure that we check and that it is child-friendly and engaging. So that is one of the things that we're doing at a national level with the National Task Force. At community level, our community coaches are still engaging with the children, teaching them appropriate hygiene behaviors, how to wash their hands, and they're doing this while you know, following the social distancing protocols. And of recent, we've also provided for them a cloth mask so that as they do this initiative with the children, you know, they, as much as possible, they protect the children. But also on the sideline, you know, for households in the communities that have parents that are illiterate or do not have older siblings that can support younger siblings to do homework, the community coaches have taken it upon themselves to support those children in those households to be able to do their homework and also listen to the lessons that are currently being broadcast over radios, and they're supporting the learning of children that while they're at home. we have also developed what we call the radio drama. We have developed several episodes of radio drama. The radio dramas they're similar to the TV novella. So when you listen to the radio drama, you almost feel like you're listening to a series on television, but actually you're not watching it. So it has really very interesting characters. The drama acted by children. And we developed these dramas around issues of child protection, gender equality, and value for education for a girl child. And we are continuously emphasizing the aspect of value for education for a girl child, because we know that during this crisis, parents tend to, give the boy child more preference to study, and the girl child might be overwhelmed even with domestic chores. And so we are emphasizing that please make sure that even the girl child have access, have time to do homework, and also to listen to the lessons that are currently being broadcast over radio. We have also we are also using the public address system. So the public address system to sensitize the community about issues around COVID. It basically consists of we get a big speakers, mount them behind a truck, connect them to a microphone, and then use that drive the truck in communities, sensitizing people about COVID-19, how to prevent it, how to recognize the sign. We are working closely with the Ministry of Health. They are the ones helping us to speak about COVID-19. And we also go to the markets, because in the markets, this is where you find mothers, they go to the market in the morning and leave very late. They go home when they're tired. They don't have time to listen to radios. And so we're reaching them, we're carrying the messages about COVID-19 to them in the market there. So ideally, we know that this public address system does not follow our approach of play, but we feel that we need to make sure that the urgency that this information reaches every member of the communities where we are working as fast as possible, so that we can actually ensure that there is appropriate hygiene behaviors being practiced, and that we can mitigate and prevent COVID-19 from spreading in communities where we are working. Yeah, that is basically what we're doing, yeah, right now.
Kevin
Thank you,
Susan,
Patrick.
unfortunately, sorry, it's been very interesting, and I wish I had the full time, but I don't. I have to go to a meeting, and they're calling me right now. But this is very good, very interesting. Thank you very much. All we have to do is make sure we mute and we can hear everybody. And I'm going to mute now because you'll hear my phone ringing.
Thanks,
Okay,
Steve.
thank you.
Thanks. Bye-bye.
Bye-bye. Patrick, thank you for that. And I'd like to say you keep watching those girl childs and make sure that they are well cared for. Kevin, I want to give everybody else a heads up that I'm going to open up the line so that everybody can start asking questions. But just before I do that, I wonder if you could just comment on, considering what Patrick is talking about in Tanzania, what is happening in other countries, and what of those innovations that and responses that we've seen are possible long-term behaviors for right to play and approaches that we would take? Can you give us a sense as we look forward? Are there learnings and innovations coming through this pandemic which will really inform the work we do going forward? And what opportunities can we, if we want to frame it that way, can we take from this pandemic?
Sure. Yeah, lots. I think, Rebecca, when you said kind of necessity is the mother of innovation, I'm kind of seeing a burst of innovation within Right to Play. Certainly more innovation more quickly than I've seen at any time in the last 5 years. We're definitely speeding up our prototyping and implementation. We've been talking a lot about distance learning training, but now we've got radio shows happening in the majority of countries where we are. We have one TV show where we've actually produced 21 episodes now, relatively quickly, but it's being distributed to 41 countries, reaching 5 million kids. It's called Puzzle TV. It started in Lebanon, but it's really kind of gamifying learning. And so that's on TV. And then there's a bunch of stuff happening online in kind of low bandwidth places using WhatsApp, but then also using online e-learning and e-training. Lego Foundation has just given us a significant grant I saw this morning to actually animate all of our games, so we can be pushing them out via WhatsApp to parents, teachers, coaches, so they'll be able to they don't even have to be able to read, watch a little animation and be able to engage with kids. And so it's massively scalable, huge reach, really cost effective. So I think the biggest kind of burst of innovation is all around distance learning. And I think we're in the middle, as many of you know, of a strategic planning process. So we're kind of setting our next 5-year strategy as we speak. And literally these real-time experiments are going to have a major influence on some of the decisions we make going forward. We're learning a lot and we're learning quickly. So I think that's the silver lining.
Thanks, Kevin. I'm going to pause for a minute and see if any of you that are participating on the call want to jump in with your own question.
One question I would have is, look, those initiatives are great. One specific question could be how to reach those kids, or especially girls who don't come back to school. That's probably maybe not now, but it will be in a few weeks or months from now. And my question would be, if families hold them back and therefore are probably also not reachable via phone, or so, what can one do to mobilize those families to see the benefits of sending them back to school? Because I think also from some of your other publications, that seems to be one of the key issues that we may be faced with in a couple of months.
So Patrick, can I suggest that maybe you take the question? I know that you're doing, in fact, a lot of your response in Tanzania is very focused on girls, keeping girls learning, preventing FGM and child marriage, which really there's very little, the chance of returning to school after female genital mutilation and a child marriage is extraordinarily low. So maybe you can talk us through, at least from a Tanzania perspective, about how you're thinking of making sure that kids, specifically girls, are getting back into school.
Yeah, thank you, Kevin. Yeah, so one of the advantage, I think, one of the structures that we have on ground that is very effective is the network of community coaches that we have. We have so many community coaches in these communities, and the good thing about these community coaches, these are volunteers that are committed to working with children. They understand the value of a child being in school. And so oftentimes when many of these children are struggling, the community coaches, because they live in the neighborhoods of these children, they get to know the challenges that these children are going through. Sometimes they talk to the parents, and in a few instances where things becomes very hard, that is when the cases are referred to the social welfare officers, and then these issues are addressed. I can tell you that it's actually from this year 2020, it's much more easier to actually get a child back into school, because of the change in the law. Just in December 2019, the age of marriage in Tanzania was at 16. So this was changed to 18 in December 2019. So it was a long struggle for Right to Play and partners to make sure that they lobby government to make sure that they change these age limits. So now they don't have any excuse for them to keep a child that has not reached that age of marriage that they want to, to give away that child for marriage. So the network of community coaches that we have plays a very, very important role, and that passion for the program, that passion for children in the community is very important. What we are also doing, we have teachers network meeting going on using the WhatsApp platform. And the teachers network meeting, what we are doing is that we are addressing the issues of reintegration. With school closing, school used to be a very good support structure for children. If they're experiencing any abuse, any challenges at home, they would go to teachers, and teachers would then be able to talk either with their parents or be able to transfer them to the gender desk at the police if the issue is grave. But right now, what we are doing is that we're continuing to engage teachers on issues around child protection, issues around making sure that they try as much as possible as school begins, try to make sure that those that are not returning to school, they try to trace them and find out why they're not returning to school. And if they find that that child maybe is being retained against our will or his will, then they should be able to take the appropriate action, because now the referral systems are well established in the communities that we are working in. So the network of teachers that we have, plus the community coaches, I think that is significant to make sure that the girls and the children return to school.
Patrick, I wonder if you told me a really interesting story a couple of days ago about specifically girls who'd heard our radio drama and actually end up in that referral system that you're talking about. I don't know if you can just like really quickly talk about that, because what it does, Michael, is that it brings to life that there are systems in these communities that once the girl, her sister, her brother, her relative knows that she's at risk of a child marriage, can be referred into, and then if the child marriage has been prevented via this system, they can actually get back into school. And I think there was a really good example, I think from last week in a Right to Play program in Tanzania.
Yeah, so there's one of our programs in Serengeti district, we call it Girls on Track. It's basically addressing barriers that prevent children from accessing education. So it works with lower secondary school children and primary school children. So this girl, her name is Eunice. She's 17 years old. She's in secondary school. And so because of school closure, the father was putting a lot of pressure on her to undergo female genital mutilation. And you know, she told us, she told the community coach that in 2018, our sister also underwent the same process, and our sister was unable to return to school because then the parents were looking for a man to marry the sister, so they couldn't take the sister to school. She was the only one in school because she did not undergo that process. And so the pressure was coming both from the mother and also from the father, that she has to undergo that process. So traditionally, this process takes place in December, but because of school closure and because everybody is a kind of you know, afraid of COVID-19 and all those kind of things, the government offices, you know, you rarely find people that are open. You rarely find people, so it's an opportunity for these traditionalists to carry out their practice that they normally do in December. Now they're doing it during this time. That's why there was a surge in the month of March and April of female genital mutilation. So the first two episodes of the radio drama that we broadcasted, the first one was on female genital mutilation, the side effects. Then the second one was on early child marriages. We normally do the broadcast on Saturday and Sunday. So when the mother actually listened to the radio, she actually began to agree with the daughter. She started to side with the daughter. And so what she then did was that the daughter called her teacher at the secondary school. Then the teacher reached out to our community coach, and the community coach then told the teacher that, look, this girl, if she wants assistance, she has to make sure that she comes to the town. So what then happened was that the mother of the girl was the one that gave this girl and her sister transport money without the father knowing. And then they came to Right to Play office, and then they reported to the community coach. The community coach referred them to the gender desk at the police station. The gender desk at the police station then referred them to a safe home. Now at the safe home, that is where they are up to now as I speak to you. We're trying to follow the process and see what is happening. But while they stay at the safe home, what happened is that the gender focal person at the police then begins the process of working with community leaders, with the parents to reintegrate these girls back and make sure that they go back to school. Even the sister that was supposed to be in school, whose studies was stopped, should actually even go back to school. So that is the process. That is where we are. As we speak, they are now in the safe house in Serengeti town. We hope that as the school season opens, that they will go back to school. But the process we are undertaking right now is to reintegrate them back into the community, and the police is leading this process. And we are excited that Eunice will not undergo female genital mutilation, and that she will be able to continue with our school. So this is what happened in actually the last week of April. That is what happened. Yeah.
Wow, Patrick, that's fingers crossed that all continues to work out. Thank you. Johan, you've joined the call. Johan, I want to give you the opportunity to close the call because we've come to the end of our time. And there you are. It looks like you've had a haircut. It must be all back to normal in Norway.
Yes, yes. Thank you so much. And I'm first a big apologies for being late. I mean, we're hearing about all these extreme serious issues for children. My personal children problem do not count, but it did make me delayed to get on this call. I had to admit, I was just no way. I couldn't get away from some screaming problems. But they are minor in comparing to what Patrick has been describing and what Rebecca knows on a big scale or Kevin are dealing with every single day. So for us, I think it's right to play. I mean, it's been, as you've heard, a very, very trying times. Been very tough like it is for everyone, but there's still a lot more trying times to come. I think people knows that we haven't seen the worst in the countries where we're operating, and much more to come. So we and the preparedness for Right to Play has been impressive, and I just want to thank and congratulate the team for making us ready, and especially to Patrick and all the country managers we have out there. They're doing what they can to kind of be safe and protect the children, educate them, making sure they're getting the right information, and as you say, extremely innovations in a way of reaching out not only to the one we have in our programs, but around many, many more who needs our service and helps. And to all of you here in the Global Leadership Council, we thank you for your tremendous support, and you kind of are our bone and our structure to the organization. Now you are the one who's making sure that we can be innovative and that we can change quickly. We have the opportunity to support them, even though with these the extreme trying times. As you know, Kevin and Susan and the team has tried a lot in relation to fundraising, because that's tough these days. We have looked at new ways to raise capital when you can't have events. How can we raise more support towards the organization? Your core support is super critical, and we are very, very thankful for that. I would say, you know, we're very much looking forward to meeting you all in next year in Switzerland, when we're going to have our summit, which we had to cancel this year or delay with a full year. We realized that this is better doing it this way, and we hope to start communicating more with you through, now everybody's getting used to Zoom and go-to meetings and Teams and all type of video conferences around the world, and hopefully we can get more information to you, meeting more like this. I am very, very impressed and thankful for your update and information. It's very, very helpful. I think on behalf of the Global Leadership Council, to the team and the management and the team in the field, we just want to give you all the best wishes and lucks for, and work hard for the next coming months, when really we're gonna see more infections coming to the countries where we're operating. As you know, the numbers of infections are unknown, and they will see it in a number of people's both sadly being with high level of disease and dying. And I think it's going to be more critical for what we are doing going forward over the next month. So I just want to wish the team there a lot of good luck, and we will try as best as we can to support you going forward. Hopefully we can be able to mobilize, as you done, Kevin, and the team, and mobilize new resources and more resources from through this COVID response. And thank you all for your continued support to us. Susan.
Thank you, Johan. And
Susan, may I make a short comment? This is Adrian Keller from Switzerland.
Yes, please do.
Very carefully to Rebecca, and it reminds me of the origin we had in Thailand. And I think this getting back people with a meal and having something like that is something most certainly your people should tell our organization in Thailand to reinstitute that. We even producing masks now for our employees. We do all sorts of these things. Use that, but I think to other partners that are not just money partners, but that can contribute something and want to the community. I think what Rebecca said is spot on. And I know that in Thailand we have a lot of people who basically don't know where the next day's meal will come from, and they will let their children go just to get that meal back home. And that's a wonderful way to educate the parents about a lot of things, including getting some masks home so that they can protect themselves. Sorry.
Thanks, Adrian. That's an important message, and Rebecca, I leave that with you. But I also want to thank you, Rebecca,
totally right. It's also a great way to get girls back into school. So
yes,
absolutely.
Thank you to all of you for spending your time with us this morning. Thank you for all you do for Right to Play. We are most grateful, and we will be in touch. Thank you all.
Thank you. Bye-bye.
Bye. Thank you.